Substance use disorder affects not only the person who's actually struggling, but also every system that that person is involved in. And so their work system, their family system.
You know, most people don't see substance abuse as a real disease. They see it as a social failure, right? So there's tremendous stigma still attached to the disease itself.
But what science has proved, the evidence now shows, is that substance and co-occurring mental health is a brain illness. And it really needs to be treated as such.
A lot of substance use disorder, unlike other chronic conditions, goes undetected. And it goes undetected, undiagnosed, and untreated. And even when it's treated, we see some poor outcomes.
My name is Jeff Sepasi.
My name is Alexandra Spessett.
I'm Audrey Wetzel.
Jonathan Ferguson, I'm the Chief Executive Officer for Truusight.
Chief Sales Officer for Truusight.
And I am a medical doctor, and I specialize in psychiatry.
My background is actually on the health technology side. I've been doing healthcare solutions, technology solutions for probably 27 plus years.
A 35-year career in working with large employers on a voluntary benefits offering. And one thing that I've seen as I've gone out into the marketplace over the last year and a half and talked to very large companies and unions and organizations, that we find most of them to this point know they have a problem. They just don't know to what level or what to really do about it. And when we can come in and provide these population tools to help put a clear roadmap in front of them, then the question becomes is, what do you do about that? And that's where we've brought on a great clinical team with Audrey and Alex to be able to take and bring clinical oversight and care management to actually change the way that those are handled.
In healthcare, cost exist where conditions overlap. A person suffering from substance use disorder does not only have the substance use disorder. They have other co-occurring mental health needs. Some may have been recognized, some may not have. They also a lot of time have other comorbidities. Those comorbidities maybe are chronic conditions that we think of all the time, like heart problems or diabetes. But it's when these things overlap that cost accelerates.
Employers are a part of the community. Their business success has a lot to do with the people who work for them. That's their biggest asset.
One study showed that 1 in 10 children under 18 live with at least one individual that has substance use disorder.
For the most part, the current system looks at substance abuse and substance disorder with any type of co-occurring mental health as part of behavioral health. And behavioral health obviously is a very small portion of healthcare as it relates to spend, so they don't pick up on these cost factors that are actually impacting their company and their business to a much greater degree. For example, a lot of these costs are at the healthcare level, hitting the emergency room, urgent care, primary care physicians, chiropractors.
Presenteeism presents an employee that's not ready to do the work that they've been hired to do, and then of course absenteeism in that they're not showing up at all. And so for an employer, this is critical.
Unfortunately, managing substance use disorder is like managing any long-term chronic illness. It's much like diabetes management. We know that we can't just take somebody that's type 2 diabetic and fix them and they're good, they're cured, right? There's a lot of behavior that has to be managed, and there's a lot of great providers out there. Our job is connecting those individuals to those right providers.
When we work with employers, we become experts in that employer's provider directory. Let's say that I have been suffering from a substance use disorder or a mental illness. I have a list of names, but I don't really necessarily know what kind of help I need. I don't know what level of help I need. And really, it's so difficult, especially for someone who's in a crisis moment, who may not be able to think as clearly as they otherwise would, to really hone in on what kind of care they need and who's the person to provide it. Ann Smith in the directory, is that the person? It's pretty difficult to navigate networks.
We often talk about the components that exist throughout the benefits arena or through the healthcare system as bricks. There's a lot of great bricks that are out there. Unfortunately, sometimes those bricks lie in a pile, and we become the mortar that helps connect those bricks and put those bricks together.
We're not here to really replace what a lot of companies may be doing already. We provide guidance, making sure that that network that's already in place for the employee is utilized, and making sure that the member, we're advocating for the member throughout their treatment process. We actually follow the patient from treatment into recovery.
Treatment is only the beginning, and without the right support, there's a fairly high chance that people will end up right where they started.
Value to the organization is really defined in the outcomes, and those outcomes can be a range of different metrics that we look at. Truusight really exists as an oversight organization. So we certainly believe in measuring the problem, which is where the population health strategy comes into play. We need the data to be able to create those baselines. We need the data to be able to see what exists within that given population. But although that data is important, we would also fall short if we didn't help to navigate folks through that system, which creates another set of data outcomes and measurements where we can see improvement. We know that healthier employees or happier employees, they also cost less in healthcare. And so all conditions have to be looked at and met with effective care.